So building public healthcare infrastructure is not like building any customer app, right? It's not that easy. So you were designing repositories that million of people lives would depend upon, immunization records, prescription drug data, outbreak management, and a lot of other different stuff. And what are the toughest challenges you think were that moment of time when you were designing assets of that scale?
It comes down to a fundamental misalignment incentives that leads to some pretty dysfunctional governance around the tools and the data. The business staff, the health policy staff, were not good at communicating requirements to the IT staff, and the IT staff weren't very good at wrapping their head around the business outcomes that the system that they're building were aimed to deliver. So that gap, it meant that really complex processes would get oversimplified just so that it could in the BRD. Even when they were implemented true to requirement, they're not really probably what you needed, right? So we lack that iterative, agile way of approaching the problem.